Here we go. We have a 56-year-old woman who presents with bright red blood per rectum and reports 3 large bloody stools over the past 2 days with mild abdominal cramps. She underwent radiation therapy for a cervical cancer 14 months ago. The patient has no fever. Vitals are stable. Colonoscopy shows that the rectum has paleness of the mucosa, tissue that bleeds when touched, and multiple dilated blood vessels. Hemoglobin is 9.6. Diverticula are seen in the transverse and descending colon. The answer for this one's going to be radiation proctitis. And our explanation, before I explain why it's RP, we have Crohn's disease. Crohn's disease, you're going to get diarrhea, abdominal pain, and lesions perianal. We are going to have deep colonic ulcerations and skip lesions seen on colonoscopy, and it can cause hematochezia. Clostridioides difficile, this is very simple from step 1, watery diarrhea, elevated body temperature, elevated white blood cell count, associated with antibiotic exposure. This was an easy take-off choice. We can just take this one off. Angiodysplasia, usually seen in elderly patients, chronic kidney disease patients, and those suffering from severe aortic stenosis. Remember, angiodysplasia is an arteriovenous malformation. Again, you're going to see in elderly patients, those with chronic kidney disease, and severe aortic stenosis is a big one. And because we're dealing with radiation therapy towards our pelvic area for the treatment of cervical cancer in this patient, that's why we're going with radiation proctitis. Okay, ischemic colitis is due to hypoperfusion, seen in states where hypotension occurs. So decreased blood pressure. This occurs in septic shock patients and acute heart failure patients. You're going to see it in watershed areas, the rectosigmoid junction, and splenic flexure. Diverticulitis, this is refers to the mucosal inflammation in the sigmoid colon. This patient, we're dealing with diverticula, but not in the sigmoid colon. We're dealing with diverticula in the transverse and descending colon. Okay, radiation proctitis refers to damage to the rectal epithelium that's associated with pelvic radiation therapy. So radiation therapy that's targeted toward, for example, in this patient with cervical cancer. Okay, we have 2 types of radiation proctitis. We have acute radiation proctitis and chronic. And acute usually occurs in patients 8 weeks and less after being exposed to radiation therapy, where they have damage to the mucosa. Symptoms include diarrhea, mucus discharge, tenesmus, and very minimal bleeding. When we do an endoscopy, we're going to see erythema, edema, and ulcerations. Management of acute radiation proctitis is going to be antidiarrheals and butyrate enemas. Now, in chronic radiation proctitis, it's going to be greater than 3 months to many years after exposure to radiation, versus acute was just less than 8 weeks. Chronic radiation proctitis, we're going to have fibrosis of our submucosa. We're going to have ischemia, chronic mucosal ischemia, and obliterative endoarteritis. Symptoms or manifestations of chronic radiation proctitis, you're going to have severe bleeding, versus in acute radiation proctitis where it was minimal bleeding. In chronic radiation proctitis, we're going to have severe bleeding, so anemic patient like we have in this one. Endoscopic appearance, you're going to have multiple telangiectasias. In the question stem, it stated dilated blood vessels. We're going to have paleness of our mucosa in chronic radiation proctitis, and friability, meaning we touch the tissue, it breaks off easily. So again, in chronic radiation proctitis, we're going to have multiple telangiectasias, paleness of our mucosa, and friability, versus acute radiation proctitis where we just get severe erythema, edema, and ulceration. Management for chronic radiation proctitis includes endoscopic thermocoagulation, sucralfate, and glucocorticoid enemas. Thank you very much, and please subscribe so you get more videos to help you support your Step 2 CK score. Thank you.